That's okay. Good evening. Let's see, let me sit down. Okay, let's see. Okay. All right, good evening, everyone. Today is September 3rd, 2024, and it is 5:12. As a quorum of the board is in attendance, I would like to call to order the meeting of the Central Health Board of Managers. I understand that there is no public communication tonight, that no one has signed up. That's right, okay. We'll now proceed to the regular agenda. We will start with the item number 1, which is discuss and take action on the Central Health fiscal year 2025 budget regarding recently received opioid settlement funds. And then members, well, we'll just proceed from there. Let's take up that one first.
Thank you, Jeff Knoll, Chief Financial Officer for Central Health. And this is a real quick item. We were recently informed by the state that they were sending the opioid funds to us. Can we go to attachment C? And so the good news is the amounts were more than what we had projected. And so we thought at this point, we'd take the opportunity just to slightly amend our approved budget to reflect the actual amount that we actually have received. So we're requesting a change in our opioid litigation settlement line, which again is a restricted fund, and the state determines how those funds can be spent. We're requesting an increase from $3.8 million to $4,664,833. We could go to attachment, the next slide on attachment A. Nope. And so we've made those changes in our attachment A budget and request that the board approve this revised amount.
Does anyone have any questions? Did you have a question?
Can I make the motion?
Sure.
I'll make the motion. I move that the board amend the Central Health fiscal year 2025 budget and direct Central Health to spend the additional opiate settlement funds as directed by Texas law.
Do we have a second?
I second.
Okay. Manager Brinson, thank you. Do we have any questions or any discussion? Manager Masako.
Thank you. So, do we have any idea how we're gonna spend this additional funding?
No, we will bring that back to the board
Okay,
as it relates to make sure it complies with the Texas statutes, but we'll bring a plan back to the board.
so when do you anticipate bringing it back?
It'll be next year, probably early, hopefully. Well, I'm speaking as I look at my clinical partners here, but as we determine more about how we want to spend it, I suspect the first half of or the first quarter, we'll have a plan that we can develop and hopefully bring back.
Okay, thank you so much.
Manager Jones, did you have a question?
Yeah, just one quick question. So will we have the opportunity to give input into what, into those dollars where they may go, consistent with state rules?
Thank you for your question. The board would have input as it relates to how the state prescribes it could be spent, what it could be spent on. I think staff would bring a proposal and get input from the board on that.
Okay, my question just goes to the question of this. I know no one wants to talk about this, but the disparity.
We can't, Manager Jones, we can't quite hear you. It's a little muffled.
Oh, I'm sorry. My question goes to the question of disparity in substance abuse and the like. That's where I was headed with that, but we'll have time later to talk about strategies then.
Okay. Manager Martin, do you have any questions?
I don't, thank you.
Okay. Looking around the room, not seeing any other questions. So all in favor?
Aye.
Okay, motion passes.
Thank you.
Okay. Managers, we are going to be taking up item 3 in open session next. And then we'll go into closed session for both item 2 and part of 3. So item number 3 relates to receive an update and discuss increasing budgetary support to community care health centers and related agreements. We will take up in open session the briefing related to the funding approach, and then we will take up items related to certain legal requirements in closed session. So with regard to the budgetary approach, I want to say just a few things first. What we're talking about here in our, let me also just say this item is a informational item. It's not an action item for tonight. So let me say first that what we're going to hear about tonight is a budgetary approach that is new for CUC that I believe our Dr. Lee and our team is calling a common law approach or common budget. Say it again. It's common
Bottom line.
excuse me, common bottom line approach. And basically what that is which they will describe in more detail, but basically the idea there is to provide more certainty in terms of the dollars available for CUC and also to provide them upfront. So we're talking about an upfront payment with an approach for reconciliation at the end of the year, and Jeff will tell us more details about that. So that's new. We're also talking about additional dollars over last year's budget, which I believe is about 20 million over last year's budget. And let me remind the board that we have already approved 74 million for the CUC board. We approved that as part of our budget. It is in the budget. And so this is not a question of whether or not we're going to approve 74 million. That's done. We also approved it for this, for this year. So, which means it starts at the beginning of the fiscal year. So I wanted to make that clear. Now, we do have certain responsibilities, as does CUC and us, because we're a public entity model under FQHCs, and so there's requirements around that. We'll talk about that in closed session. We also know that with a new funding approach, there may be some discussions that we need to have about what's the nuts and bolts of that new approach. We will work with the CUC board over the next number of months to collaboratively and transparently develop those nuts and bolts. That is not, the funding that we've approved is not contingent on that. It is something we do need to work through though. So we'll get to that over the next couple of months. So what we're going to do first now is we're going to hear about that funding approach, and then we'll go into closed session later to talk about those legal responsibilities that I mentioned. So do you want to go ahead, Joe?
Yeah, thank you. Yes, as Manager Kitchen mentioned, what we're calling this is the common bottom line approach. And it is different than what we've done the last few years. The last few years, we've had more of a contractual relationship with community care where we paid for services, paid X amount for X services. It was a much more transactional approach. This approach is much more holistic, much more unified as it relates to a public health center model. There's a a lot of collaboration involved in both parties. And the concept of it from a funding standpoint is that there's a bottom line that gap based on completion of all the budget elements except the central health piece. And that central health and community care would collaborate to ascertain the amount, to collaborate on the services to be provided. And so this is the vision that we have as it relates to funding. So mechanically, how that would work is the bottom line amount, which we've agreed to, and I'll talk a little bit about where we're at. Mechanically, how it would work is there's a bottom line number, and central health and community care would look collaboratively and look at liquidity needs and use that as a guidepost to fund community care based on periodic needs. And my anticipation would be that that's on a monthly basis, much like how we paid them anyway transactionally. But again, transactionally was based on the number of transactions, and that determined the amount. This is, again, a much broader, more unified approach. And so we began discussions with community care last week, and there's a lot of detail that we need to work through related around this approach. But the one area that there was a lot of agreement with was to get out of to implement a bottom line approach and get out of a transactional approach, which does create a lot of uncertainty on the community care side because they're dependent again on the level of services. And so we agreed late last week. Pat instructed me to go meet with community care. Did so Friday. We looked at the request that community care had made, and we agree that the amount of the request that's been made, that Central Health would, can I call it bottom line fund that amount for fiscal year 2025. And so there was a agreement amongst the CFOs and amongst the entities. There may be some additional reviews, but we'll continue to refine the process as we go. But I think it was important to take this first step. And so we've taken this first step as far as approving the amount, relinquishing any uncertainty that community care may have related to their budget process. And there'll be a lot more discussion as time goes as it relates to the full implementation of it. But again, we think this is a really positive approach to collaborating in our public health center model.
I'll ask one very quick question and see if others have questions. So am I understanding correctly that this kind of approach provides more certainty, I guess, because it is an agreed upon amount that is paid up front and then reconciled later as opposed to after the service is provided? Is that a good way to think about it, or?
It could be. I think we need to work through that detail. Again,
Okay.
it's really based more on community care's liquidity needs.
Okay,
It could very well be done upfront on a
Okay.
monthly basis. There's a lot of different ways we could look at it. I think the key is just looking to see what best suits community care as it relates to their needs.
okay. And by liquidity, you mean cash flow?
Yeah, there are some cash levels that they want to maintain. We typically call it days of reserves on hand. They
Okay.
call it days of cash. And so we'd want to make sure that we're managing that appropriately. And so there may be some cases where,
Okay,
for whatever reason, let's just pretend for whatever reason, third-party payers are slow. There's something that happens. We may advance cash a little faster in that case. And then if those third-party payers pick up, then, it may be a little bit less, but it's with a bottom line in mind. So we have
Okay.
a fixed amount that we're looking at and that we would reconcile to the bottom line at year end.
okay. So for this year, there's been an agreement that 74 million should be the amount that's needed, right? And so the idea is to provide more certainty about when that comes, to help with any cash flow issues, all of those kinds of things. And so the thinking is that it's more of a partnership kind of approach for payment. Is that the thinking?
Absolutely. It's
Okay.
absolutely much more of a partnership collaboration process.
Okay, all right, I'm gonna go around the room. Manager Musaka, if you have questions.
Yes, thank you, Jeff, for that. With this new proposed model that you have the common bottom line, in terms of, would this enhance patient outcomes? And that is really the overall, because we're talking about a collaborative model, a holistic model. How would this model differ comparison to what we have for our patient population in terms of their reducing the health disparities, improving their health outcomes, and productivity in life? So that is something that I would be interested in learning. And the second question that I have, and Dr. Lee follow up, how many of our patients, if you can remind me the number, because I know that community care has a mixed of patients of third payers or Medicaid recipients and Medicare. So for our population, how many do they see as well, the end number on an annual basis? Thank you.
I'll start with the last question first. I believe it's about 40 or 45% of our patients. I think that's, oh, was it 50? Okay, 55. So apologies, I was a little low. So 55% of community care patients are MAP basic patients.
And I'm happy
You had two
to
questions.
Yeah, Dr.
Oh, okay.
pick up on the first one. This is the whole point. So you're exactly right. Community care and central health collaboration is absolutely essential to achieving our mission together. There's no health without primary care and preventive services, but many of our patients need specialty care, transitions of care, wraparound care, and the overall coordination of care across the care continuum. So we want to work entirely hand in glove through the planning process, the budgeting process, the care delivery process, the care improvement process, and we want to be able to extend the ability to look into the out years together. So one of the challenges with a transactional approach is it limits how far out actually community care can look because they're waiting to hear that number. Whereas in this common bottom line approach, as we build toward that together, that we remove that uncertainty and we can really work side by side to plan out that future. So that's very much the intent. And I'll add one more comment, which is actually that both executive teams had a great desire to increase transparency in our work together. And we realized as we began to look at it that there was a systems issue. The systems issue being that when you're negotiating a contract, there's something inherently, back and forth about that. It's actually not, it doesn't promote the full transparency of partners side by side, looking at a shared budget and working toward shared goals. So this is a step to remove what we found to be actually a systems issue that was getting in the way of the transparency that we all desire.
Okay, other questions? Manager May?
Microphone.
As I said, this is an exciting approach. I certainly look forward to hearing more about it. The only question I have is, so the new money that we're asking, or they're asking us to approve, is what amount?
It's excuse me, $74,106,373.
In addition to what we had already approved?
That's just the amount. It's not in addition. It's just,
That's the
this is
amount.
this is the total community care request
Got it.
for
Okay,
fiscal year 2025.
okay, thank you.
I believe, but it is more than last year, right? So you may be thinking of something I said. It's what, 20 million more than last year?
Hello. Which one? I mean, yeah.
All right, it's my name is Tasha. I have your discharge paperwork here. How was your visit?
It was good.
Can we mute other people for the moment? Okay, so just to clarify, is it 20 million over last year?
It's a little complicated.
Okay, well, that's all right.
Yeah.
The point is, it's what
it's
they
more-
asked for, and it's more
Yes,
than
it's-
last year.
Yes, that's correct.
And we've already approved it.
So, okay, so we're only approving the approach?
We're not approving anything. This is informational.
Oh, got it. Okay.
Yeah, I mean, we already voted on
Their
it
budget.
because it's that 74 million is in the budget we voted on.
Got it. Okay.
Yeah. So, and this is informational because as a board, some of the nuts and bolts around it is something that we'll have further discussion about later after there's more conversation about how that's happened. And the nuts and bolts are something that at a board level, we may be asked to weigh in on, but the amount we've already voted on. Got it. So, other questions? Manager Jones, I see a hand up. Or is that Manager Martin?
Yeah, I have a question.
Go ahead.
So I guess I'm not completely understanding the model. Since you're giving them a lump sum of money, with transparency, assuming there's cost savings or money not spent, I guess I don't understand how that money's gonna flow. Does that make sense?
Well, first of all, I don't think there are any assurances that there are cost savings. I would call it more system investing in a collaborative process. So I just want to eliminate any perception that we're doing something around services that is cutting costs. I think we're actually going to be providing more services and investing in those services in a collaborative way. That's kind of my short way of explaining it.
Okay, thank you.
I have a follow-up question, but let's see, does anyone else have a question? Did he, Manager Jones, did you have a question? Is he on? He's on. Is he on? Is he on or? Okay. All right, well, let me go ahead then, because we're not hearing him. Okay, so then, yeah, so it's is it more of a funds flow difference then that we're talking about? I'm following up on Manager Martin's question.
Well, the funds flow is different. It's different. Again, it's not a transactional way of payment.
Okay,
So it's not predicated on providing X amount of services at X amount of rate.
okay,
It's really, again, predicated more on a collaborative process that, whatever our investment is in the system, that we're looking at the bottom line and investing across both of our systems.
So
okay,
it's not like
Manager.
a fee for service.
No, it's not a fee
Okay.
for service. It is a bottom line amount that we look at, and we fund that on I'm going to say periodic. It more than likely will be a monthly basis based again on the liquidity needs.
Okay, Manager Martin, did I see you raise your hand again or?
Yeah, I guess what I was alluding to, as a doctor, I'm thinking, does this represent kind of a form of capitated payment? Is that kind of what you're describing?
It's it's not a PM type of capitated payment, but it can be called a capitated payment as it relates to MAP and MAP members, the services that we're providing to our patients.
So it's not capitated in the sense that capitation, so fee for service is I bill you, you pay me after I do the services. Capitation is we're going to agree up front that for each person, it costs a certain dollar amount, and you're going to tell us how many people, and we're going to pay you that amount. This one is more, if I'm understanding correctly, it's more, we're looking at the total cost up front, based on everybody working together on what that cost is. And then we're going to figure out a periodic approach to just paying you that, which may be monthly, like you said. But it's the dollar amount is based on everybody's best estimate about what is needed. Is that right?
That's correct.
Okay.
The best,
Okay, can you hear me now?
Yes, go ahead, Manager Jones.
Okay, so in terms of our funding for some of these initiatives that we've put forth this year, what we're saying basically is we're going to do more of a holistic approach and provide funding for all of these initiatives based upon various criteria, but not on a per capita basis type of thing.
Is that right, Jeff?
Initiatives that central health and community care develop together.
For instance, you remember we've asked for the funding for the outreach services. We've asked for funding for the Black Men's Health Clinic. We've asked funding for these other, all of these would be wrapped up in a pool, I assume, of funding that will be understood by all of the players, all of the contractors, and by us.
Just to be, Manager Jones, if I could be clear about, I think your question, the outreach for the Black Men's Health Clinic would be in the central health budget. That would be, central health budget. The services would be in community care and would be part of that initiative.
Right, but I just want to make sure that they have to link up together in terms of coordination, and that's what my concern is. That they're not going to be able to,
Yeah, I absolutely agree with you in that regard.
Okay, then, thanks very much.
Did Manager Musaitis?
So explain to me, is it more of a value-based health plan that you're looking at? They achieve certain outcomes, you pay them or bundled, so.
Yeah, it's a great question, and this is a great discussion. Even in a value-based arrangement, one side is now trying to save money against, total amount that you get paid for performing a certain task or seeing a certain number of patients with a certain amount of comorbidities and so on. This is really a full partnership approach. Is to say, for this year, we're simply accepting the diligent and thoughtful planning that our colleagues have done that adds up to approximately 74 million, saying, great, we trust you. We're just going to go ahead and move in the common bottom line approach, starting with that number and solve for liquidity. Right away, we're going to start saying, well, how do we plan together for the next budget together, the same way we have together, right? What are the driving priorities? What are the things we need to solve for together now with a full view across the whole enterprise and system? And let's figure out what needs to be solved. Then let's plan the activities. Then let's figure out what that's going to cost. Let's come to a steady agreement all along the way. And whatever that bottom line amount is for next year, again, we'll just sort of roll it through. So this is very much closer to the way that we budget for our budget. What problems we need to solve for? Let's talk about that together. Right, let's do this transparently. Let's not try and make a transaction contract around this between separate parties. This is a collaborative partnership approach.
In a concise way, the way I view what this approach is, we're basically shoring up our partnership with them
100%.
in a very concise way. That's how I see it.
Showing up meaning we have their back. Right.
And that way they can move forward without being, worrying about all the financial things that may come or may not come, because as we know, there are a lot of unknowns that come along the way. And all of a sudden it causes them to have a skew in their budget. And then they're running around like, chickens by the head trying to figure that out, right? So this enables, hopefully it enables us as a result of the relationship, enables them to continue to stay mission focused. If that's the best way to put it. I mean.
Let's see. Manager Musaitis and then Manager Martin.
So going back to what you shared, Dr. Lee, so this will change, this is a system change. So this will require two boards to collaborate if you're talking about the budget process. And I'm just thinking about the structure of their board, how it differs than us in terms of transparency, because we have no say to on their budget. Again, we don't vote up or down sometimes, like our budget, we haven't approved their budget. They just share with us their approved budget. So I'm just trying to think of, will that change the
If I may,
structure?
Chair Kitchen had indicated there's sort of two parts to the conversation today. A very important part is to think about the nuts and bolts together. And so we will do that momentarily.
Yeah, I'll just add, nuts and bolts questions are relate to CUC's responsibilities and our responsibilities under the co-applicant agreement, and we'll be talking about that in closed session. Now, I would say that what we're talking about here is how we pay them for our patients, okay? There are aspects of what CUC does that is different. You know, that's not our patients, that's Medicaid patients, for example. So what we're talking about here is a change in how we pay. But we'll talk about that more in closed session. Because it's legal issues, we have to talk about it in closed session. So, okay, Manager Martin?
Thank you. So I guess I'm looking, and maybe I don't understand the relationship correctly, but it seems like community care essentially is a subcontractor for us. I can think of it that way. It seems to me we're losing some accountability versus a vis-a-vis transaction. We solved 3,800 patients. We did this. I mean, I guess I'm not understanding the relationship completely, because I think it does leave a lot up to their budget and their decisions. And I know that would work with them, but it seems to me that if anything, the transactional relationship seems a lot clearer for us.
May I just invite us to make sure that we can proceed into the next phase of our conversation where those are critical questions, and we will certainly provide clarity around that. I just want to offer one point of clarity, if I may, Chair Kitchen, and that is that together with community care, we are the public health center. All of the health center's patients are our shared responsibility as the health centers, both of us together. And we'll go into more of that in detail to follow, but just want to make sure that it's not just the folks on Map Basic, it is all of the patients that are our.
Then I do have a lot more, I have a lot more questions if that's the case, from a financial perspective. But, because I thought we were talking about our patients here in terms of the 74 million. Is the 74 million supposed to cover all their patients or just our patients?
I think the 74 million
Mhm.
may be much more germane to the patients that
Okay.
that we're talking about. However, the scope of our shared budgeting and collaboration
Okay,
includes the full
so that's a
health
different,
center.
that's a
Yeah,
different
the full health
question.
center.
Okay,
And again, I think we know it's important to provide for the clarity. That is the purpose of the conversation that happens next in closed session.
okay. Other questions? Welcome. Sorry. That's okay. Any other questions? Okay, just to reiterate, from what I'm understanding is we approved in our budget 74 million for CUC, and that was the total amount that CUC requested as needing this coming year. So we've approved that. And that starts as part of this budget year. There are nuts and bolts that need to be figured out in terms of exactly how this approach works, this that we're talking about, this common bottom line approach. And that those nuts and bolts can be discussed over the next number of months and mutually discussed and agreed upon with the CUC board, so long as we're all in compliance with the co-applicant agreement and our responsibilities as a taxpaying entity. So that's a wrap up. And we went over a lot, Manager Valadez. Okay. Well, let me just tell you first, we are going into closed session on this same topic.
Oh, to talk about this?
Yeah, so.
I'll wait.
Okay, okay. All right, thank you. Okay, so now I'm going to, we're gonna go into closed session now because items number 2 and the remaining part of this number 3 will be in closed session. So I announce that the board is convening in closed session to discuss agenda items 2 and 3 under Texas Government Code Section 551.071, consultation with attorney.
Could you read 2 for us? You haven't announced number 2.
Oh, I need to say what they are. All right. Item number 2 is discuss updates on matters related to performance review contracted by Travis County, including delegations to the president and CEO to execute necessary agreements between Central Health, Travis County, and Mazars USA. Item number 3 is receive an update and discuss increasing budgetary support to community care health centers and related agreements, which is the legal part of it. Is that right? Okay. All right, as soon as we're ready.
Date and time.
Oh, gosh, I'm really, okay, today is September 3rd, the time is 5:46.
Now we're good.
Are we ready yet? We ready? Okay, all right. Everyone, we are going back into open session. It is September 3rd and it is 8:33 and we are entering open session. Our last item of business is to confirm the next regular board meeting date, time, and location. So managers, our next Central Health Board of Managers meeting is scheduled for next Wednesday, September 11th at 4 p.m. here at the Central Health offices. At this time, I'm ready to accept a motion for adjournment from Manager Valadez, seconded from
I second.
Manager Brinson. All in favor?
Aye.
All right, we are adjourned. Thank you.